experiments with smart blood concentrates started decades ago. And initially, they were finding that when they took a tooth out and they left blood in the socket where the tooth was removed, that had a better result with healing. And then from there, it was decided, let's take the blood and spin it and separate it into layers. And let's see if what we separate and we put in to the socket will help with healing. And so the first discovery there was PRP. After the discovery of PRP was the discovery of PRF. And PRF is in several generations of discovery, and we've gone from traditional angled centrifugation with PRP with anticoagulant in the tube there to create PRP to traditional angled centrifugation of PRF, and yet PRF not requiring the anticoagulant, to now doing horizontal centrifugation and getting an increased percentage of or concentration of valuable components there. So PRF has been something that has been valuable in the world of dentistry. And Dr. Rick Myron, who was in the lab in Europe when PRF was discovered, studying with Dr. Chacroun, he was initially trained as a dentist in Canada. Dr. Myron, from there, discovering PRF with Dr. Chacroun, came back to the States and started training dentists on this new technology. So as a dentist, I travel to dental meetings and I communicate with other colleagues, and I had been aware of PRP, which is much more commonly known because it's been around longer. And Dr. Myron was at one of the meetings where I was studying with the Holistic Dental Association. So I found out about his courses. I saw that he had courses that integrated PRF training as well as facial aesthetics training. And interestingly, at that time, I just thought it would be interesting just to know about facial aesthetics. I didn't understand at that time how huge facial aesthetics was going to be for me. But I had been moving, was raising a family, and was really in a space of wanting to learn everything that I could possibly learn that was new in dentistry from the time that I started having children to the time that I was able to really start traveling again for courses. So I went to Dr. Myron's course, and it was a weekend where he was doing the aesthetics training as well as the PRF training. Interestingly, it happened to be the very first course where he integrated training with the laser and PRF training. So it was a really wonderful timing that I'm very thankful that I was able to meet Dr. Harvey Schiffman, who is an amazing and legendary instructor with Fatona. And that's how I got into PRF. So actually when I first heard of PRF, I didn't understand that PRF was newer than PRP. I had only ever heard of PRP. And so when I went to Dr. Myron's course, I was just blown away at all of the research and all of the results that were there clinically, the photos. And I just loved this technology because there's so many things that we do in dentistry and in medicine that have a risk. There's a risk and there's a benefit, and there are often side effects or potential side effects, and you don't always know, is this procedure going to succeed or is it going to fail? You always hope the best things for your patients, but you have statistics that show that maybe 50% of the time this would work, or maybe 90% of the time this would work, but maybe always some percentage of the time it's not going to work. Some percentage of the time there are going to be adverse components to whatever the treatment is that is being offered, whether it be a surgery or a medication being prescribed. With PRF, it's entirely from my client's body, and it's entirely comprised of components of their own blood that is very valuable to their vitality. It's their own growth factors, it's their own healing factors, it's their own white blood cells that fight infection, it's their own stem cells, and there's no negative aspect to those components. It's all vitality producing, vitality inducing. And I loved that about the PRF technology. And I knew when I learned about this that I wanted to bring that and to share that and to make that a big part of what I was doing in my clinical practice, both in aesthetics as well as in dentistry. Most dentists who learn about PRP and PRF are using these technologies to regenerate bone, for example, when they're doing an extraction and they want to preserve the bone in that site, because PRF will generate whatever tissue the body calls for. So if you have a socket that has 4 walls of bone, the signaling that happens with the cells within the PRF will produce the tissue that is present where the PRF is placed. Nevertheless, as I've mentioned in my video about PRF and PRP and these technologies and what they do and what they are and what they mean, it's interesting to note that we can save teeth. Dr. Val Cantor has done research and applied PRF to the tooth in a way of offering vitality to a tooth that otherwise might need a root canal or need to be extracted. You can save wounds that may otherwise be amputation candidates, like a diabetic wound of the leg or of the toe or of the foot. You can save those with PRF. Nevertheless, the cells that respond the best to PRF in the body are facial skin cells. So that's a really exciting thing to know and to be able to apply and to give people a way of looking great and feeling great about looking great, being healthier for looking great, not taking any kind of cutting corners or making any kind of sacrifices for looking well.
Thank you for being here. I hope you enjoyed this video. Remember to like and subscribe and share this clip. Look forward to seeing you here again soon. And you can check me out at GiselleBatcheller.com to see my other socials. And hey, you can even buy me a latte. With love and gratitude, have a powerful day.